Welcome to Live Longer, Live Stronger. I'm Karis Lauder, joined by the old man, Brad Lauder. And we have our special guest, Ben Fogg. Dr. Fogg, thanks for joining us back on the podcast, this time in studio and not in the office.
Happy to be back. Thanks for having me.
Last time I saw you, I got worked over pretty good. It was all, fun and games until the VO2 max test. And then it was, the poor guy administering the test, I was huffing and puffing and gasping. And he was like, "Are you okay? You having chest pains? Are you having chest pains?" I said, "No, I'm just out of shape. I'm just in crappy shape."
It was scary to watch.
He was like, he had 9-1 dialed and his finger was posed over the one. So anyway, enough of that.
Well, it's good. It means he worked you to the max, right? So they call it VO2 max for a reason. You want to get you to that max exertion. Bryant, he's smart to be aware, especially with your history. Just be aware of chest pain or anything concerning. But
it's not like I've never had a heart attack in my life. So he was smart to be vigilant about that, so I appreciate him looking out for me. And all the other tests were fascinating. Of course, the blood test, I studied for 2 weeks for that. I hope I did okay on the blood test. No? Not even.
I mean, I filmed it and it was...
I failed miserably. Why don't you talk us through... Do you want to start with the good news? Just because I still feel so embarrassed how horrible I looked in the VO2 max test that if we could start with some uplifting good news, like, "Hey, Brad, man, you rocked it in this department. And here's some good news." And anything good to report?
Yeah, the thing is that the good news is this is all a baseline. I think that's good news, right? So knowing where we're doing well and knowing what we need to improve is always helpful. We did your DEXA scan as well, and we reviewed that before. You remember the DEXA scan, looking at your body composition and... Again, the combination of the DEXA scan, looking at body composition, looking at your muscle mass, your bone density, your body fat, your visceral fat, those are helpful. So using that in combination with the VO2 max test to understand how efficient your heart and lungs and muscles all work together to use oxygen, which is one of the best predictors for longevity is your VO2 max. And so knowing what that is, understanding your training zones, and so you can train smarter and not harder, that is helpful. And then the blood work, which we're about to review.
Okay.
Yeah.
All right. So give it to us. Where is the baseline?
By the way, that didn't sound like any good news. That just sounded
he was being optimistic.
It's like, okay, now we know how bad it is, so we can have markers for improvement. I didn't hear anything like, "Brad,
setting expectations. Setting expectations is not bad news.
For dude your age, man, you just killed it in these 3 departments. There's none of that business."
We're going to review it all. I'll tell you what's good as we go. There's plenty of good.
Okay.
There's plenty of good.
All right, hit us with the blood work.
Okay. Would you like me to share the screen, or how would you want me to do that?
Yeah, please.
Yeah, that'd be cool. Yeah. All right, what do we got here?
So here, do you see the screen here?
Yep.
So this kind of gives us a list of the out of range summary. So these are the things that are out of range. We're not going to go over the things that are out of range right off the beginning. We're going to go in the kind of the appropriate order for this. So we're going to start at your complete blood count. And so this is looking at the different types of blood cells. And so this looks at your white blood cells, your red blood cells, your hemoglobin, hematocrit, then the size of your red blood cells, the spacing between your red blood cells, your platelet counts, the size of your platelet count. So it gives us a lot of information. All of these levels are normal. And so what we see with this is sometimes if people have underlying blood disorders, underlying bone disorders, underlying cancers, underlying allergies, infection, these things can be off, but your levels all look great here. We can also kind of look at hydration status based on some of these things, but again, your blood counts look great. And then we get into the differential portion, and so this is looking at the different types of white blood cells. And so you've got neutrophils, lymphocytes, monocytes, eosinophils, basophils. your neutrophil count was a little bit on the high side. This is something that can go up and down based on, if you had a recent infection, a recent allergy outbreak. Those can go up and down, but yours is borderline high. The rest of your differential looks good. Nothing I would really do anything about. These are things that we will often, a lot of these labs are things that we trend over time. So when we're looking at labs, we've got to realize this is just a snapshot of what your labs look right when you had the test drawn. But we know that a lot of these labs are going up and down, vary day to day based on hydration status, based on recent illness, recent exposures, stress levels, what you ate the day before. There's so many things that can affect your labs. And so what I like to remind all of my patients is, as we check labs, just realizing this is a snapshot and our body is constantly changing and our labs are constantly changing.
Okay, that's super helpful. Thanks.
We look at your fasting glucose, which is a little bit high, and we're going to look at glucose here. Your fasting glucose is 103. But instead of looking at just that snapshot of your fasting glucose, we also like to look at your hemoglobin A1C, which gives us an average blood sugar for the last 3 months. And I know you are familiar with hemoglobin A1C. Yep.
My youngest son is type 1 diabetic, and so learned a lot about it. And also, I've been diagnosed with type 2 diabetes, so it's something I like to keep an eye on. And before you tell me the number,
okay.
I'm down 25, 30 pounds from where I was a year ago. So I think my A1C is going to be in the normal range, or at least close to it. So hit me with the news.
Do you know what your A1C was before?
My last one, I think, was 7.2, I think.
Okay. Yeah, so your hemoglobin A1C was 6.5%. So 6.5, yeah, significant improvement from 7.2, and it was probably higher than that before when you were first diagnosed with diabetes. I'm sure it was much higher than that. And so we talked about this being a baseline. This is definitely not your baseline for your A1C, right? So this is a significant improvement. So 6.5, you're borderline diabetic, pre-diabetic. You're right on that border. And so I think, again, really good improvement in your A1C, your average blood sugar. We know that A1C and your type 1 diabetes, getting that glycemic control, controlling your blood sugar is so important because as our blood sugars are elevated, we're at risk of kidney disease, problems with our vision, our eyes, we're at risk at nerve problems, and then just overall metabolic disease.
So it's 6.5 now, which I'm taking as really good news from where
That's great.
Remind me where normal is. Is it 6.2 or what's considered?
So anything, so 5.7 to 6.4 is considered pre-diabetes. Anything from 6.5 up is considered diabetes. And so you're right on the border of kind of being not in that diabetic range. And which is a good thing. And one thing with diabetes as well is we talk about insulin and insulin resistance and how it's hard to reverse diabetes. It can happen. We can reverse diabetes or treat diabetes or get better insulin control, improve our insulin sensitivity, or also what we call decrease our insulin resistance. One thing that we looked at on here too is your fasting insulin. And fasting insulin is one that I think is very underutilized in our medical system because it is one of the best predictors of your metabolic health. And what is good for you is your fasting insulin is 6.5, which is in the normal range. And so even though your average blood sugar is on the higher side, your fasting insulin is in the normal range, which is just saying that, again, you have this insulin sensitivity. Your insulin levels aren't super high. We know that as people become diabetic, they're fasting, so their blood sugars go up. And as those blood sugars go up, their insulin levels go up. And it requires more insulin to bring your blood sugars down, and that's what we call insulin resistance. The problem with that is as our insulin levels go up, We know that our body goes into more of a storage state, and we hold on to things more. We know that with increased insulin levels, again, we go into more of a storage state. We hold on to fat. We have increased risk of metabolic disease, diabetes, cardiovascular disease, cancer. These are all things that improve as we improve our insulin. So I'm really happy that your A1Cs come down and your fasting insulins come down.
I'm encouraged. Honestly, this is very encouraging news.
He hasn't gotten to the bad stuff yet, though. So,
Yeah.
Well, on that note,
Great
So-
segue. Did you guys rehearse ahead of time?
just
a couple things. So, as we talked about with diabetes, there are risks of kidney disease. And I don't know if you've ever been diagnosed with kidney disease in the past or told that you have decreased kidney function. So there's multiple markers of kidney function that we look at. And so we look at your BUN, your creatinine. There's another lab that we look at called cystatin C. And then we look at your electrolytes, because our kidneys are kind of responsible for filtering the blood and balancing our electrolyte levels. And so your BUN was 21, which is great. Your creatinine level is a little bit high at 1.4. I don't know where this was in the past, but a little bit elevated. But looking at your sodium, your potassium, your chloride, calcium, phosphorus, magnesium, all these electrolytes look good. And so it looks like your kidney is doing a good job regulating your electrolytes. But with that creatinine being a little bit high, we like to look at another test called your cystatin C, which is another indicator of your kidney function that's independent of muscle breakdown, independent of creatine use. Your cystatin C is slightly elevated at 1.24. And so that being said, we do want to just continue to watch those kidneys really closely. You're not in a place that I'm really concerned about. It's just something we want to keep an eye on, especially knowing you have a history of diabetes. And so these are important micronutrients, vitamins that I like to watch closely, that are not always included in your typical labs.
Nice.
with the vitamins, if any one in particular is lower than the others, say, if they are all averaging good and then one is really bad, is that an indication of some kind of internal problem, or is that just? I'm saying, is that an indication of something beyond just like, hey, you're not getting enough vitamin B12 or you're not getting enough vitamin C? Is that an indicator of something bigger?
It definitely can be. That's a great question. So it definitely can be based on the vitamin, based on the based on the vitamin, whether it's too high or sometimes again it's too low. It can be an indicator depending on what it is. Most of the time, if we're deficient in certain things, it's usually because we are either not getting enough through our diet, not eating a healthy, well-balanced diet, or we're not absorbing it. So people that have GI issues and inflammatory gut issues often are not absorbing things as well. Some people that have certain mutations, MTHFR mutation, I don't know if you've heard of the MTHFR mutation. It's a methylation mutation that a lot of people have that actually makes it harder for individuals to absorb unmethylated vitamins. And so that's why anytime I'm saying, okay, if we're going to take a B12 supplement or a folate supplement, I want it to be a methylated. So methylcobalamin, so methylated B12 or methylated folate. And that can just help with absorption. And there's certain tests that we can do. There's genetic testing that we can do to see if you have a variation of this MTHFR mutation or not.
And just an aside, isn't methylation mutation the name of your garage band you had in high school?
Yeah. It was MTHFR or whatever you called me earlier.
Yeah. And what was the hit single off the A side? What was that?
It was Let Me Absorb Your Vitamin.
Yeah.
Yeah.
Your LDL is 51. So people talk about bad cholesterol, LDL. We know that there's a lot more to cholesterol than just looking at LDL. But your LDL is at 51, which we probably want there, especially with your personal history of cardiovascular disease.
Right.
And then looking at your HSCRP, so that's your high sensitive CRP, which is another marker of cardiovascular health, kind of a marker of your inflammation, your cardiovascular inflammation. You're at 0.9, which is great, which is low. So
Okay. If
That's really good.
if that's the only piece of news you were to give me, I'm a happy guy. Because honestly, that's the thing that weighs heaviest on my mind is, dude, I don't want another heart attack, especially at 68, because I may not be so lucky this time around. So that to me gives me a ton of peace of mind. It doesn't make me feel like, hey, I can just eat whatever I want and stop exercising. It feels like what I'm doing and the lifestyle changes I'm making and working on are working. So thank you. That's
great.
that is good. Well, and the other things that we look at, so we often will think about heart disease, and what we've got to realize is heart disease and cardiovascular risk is not just about cholesterol levels. It's not just about LDL, but it's also looking at, okay, well, what's your cardiac inflammatory marker, right? So how much inflammation do you have? What's your bad cholesterol? We also look at your ApoB, which is a better indicator of cardiovascular risk than just looking at your LDL, because it accounts for also the number of particles. And so your ApoB is 57, and for you, I'd like it less than 60 with your history. So that's great. Your LP little a, so lipoprotein little a, this is kind of a genetic inherited cholesterol. And this is one that is often missed. Yours is actually really good. Yours is less than 6. But this is one that often is missed, and people don't realize cardiovascular risk. Even if the rest of their cholesterol levels are normal, if you have an LP little a, this genetic inherited cholesterol that's high, your cardiovascular risk goes way up.
Okay, that's good news because, good news for both of us, but especially as I look, my father died at 67 from heart failure, heart disease. His father died at 55 from heart disease. So I feel like, inherited stuff. Yeah, so that's also great news. Well, given that, to kind of put a bow on it, what if you were to give me, I can't have a list of 30 things I got to work on. I got to simplify it so it's something actionable and memorable and feel like I can really do it. If you were to pull out from the DEXA scan, all the blood work, the VO2 max test, this whole beautiful picture that you've now painted, and say, Brad, you want to dance with your granddaughter Nori at her wedding, which means you've got to live to 91, not 81.
Yep.
Don't make that math error again. Given your whole history and everything we know, here are the 3, 4, 5 things I want you to do and focus on now. What should I be doing now, starting today, moving forward? If you were to, and I'm sure there are 100, but if you were to prioritize like 3 or 4, what would you tell me to do?
So one would be increasing your lean muscle mass. We talked about increasing your strength, so doing strength training, increasing your lean mass. Yeah. And this is something that can help in multiple ways. As you increase your muscle, we know that as you increase your muscle, you increase your GLUT4 transporters. And so GLUT4 transporters in our muscle take in glucose, and we're able to use more glucose. And so your blood sugars are going to come down. Mm-hmm. We also know that increasing your muscle is increased muscle is one of the best predictors of longevity. Yeah. We know that as you increase muscle, there's increased BDNF, so brain-derived neurotrophic factor, which can help and which can prevent dementia. And so just increasing your muscle for all of us can help with longevity and just to be able to dance and do what we're able to do, because with age we lose our muscle. It's going to help with your insulin sensitivity and your glycemic control, and it's going to help with your cognition. And so that's one thing I would do.
Okay.
Another thing is, being a diabetic, just focusing on that blood sugar control. We've got to get that A1C. Again, it's significantly improved, but we've just got to keep that in check and keep that blood sugar at those levels we want. And there's some really good tools. I know we've talked about some of these tools before. So there's GLP-1s, GIP inhibitors. There's a newer one coming out with retatrutide that's a triple G. These are incredible tools.
Yeah.
I'm all about doing as much as we can naturally through nutrition and exercise, but there are life-saving and miraculous medications that have been researched that are saving lives and that are helping with losing visceral fat, with increasing insulin sensitivity, decreasing cancer risk, decreasing cardiovascular risk, decreasing kidney disease, and GLPs are an example of those.
And one of the things you and I talked about, I don't know, a while back, was the concept of, well, and you talked about it with your buddy, the geneticist. You slapped a CGM, a continuous glucose monitor, on him. Is that, you threw that out as a possibility? Would you recommend I try that for a while? And how long should I do it? And what's kind of the protocol for that? Because I think that's something I can attack to learn. Like, am I stress eating? Am I snacking at the wrong times? Just to get a picture so I can make those little lifestyle changes.
Definitely. And so, continuous glucose monitors, or CGMs, are these little monitors that you stick on the back, typically on the back of the arm, and it has a little filament that goes underneath the skin that takes your blood sugar every 5 minutes. And so getting that information and seeing what your blood sugar is over time is super helpful, and seeing the trends. And more importantly, like you were saying, if you can track your nutrition, if you can track your activity, if you can track your sleep, you can see what is causing your blood sugars to go up, what's causing them to spike, to see how long they're staying high, looking at the area under the curve, seeing how quick they can return to baseline. Some examples back to what we were saying before with activity, seeing what just walking, doing a quick 10-minute walk after a meal will do to bring down your blood sugars. Yeah. So as you go out after having a meal, we can see that often in a lot of people, just going on a quick walk after a meal will open up those GLUT4 receptors that we talked about that are in your muscle, and kind of bring the muscle from your blood into your muscle to be used, which is great.
So I'm going to work on weight training. I'm going to start walking after. Is it all meals, dinner? What seems like I've heard.
If you walk after all meals, that's great.
I probably won't. If I were to pick one meal a day to walk after, which one would you do?
Definitely dinner.
Okay, dinner. Walk 10 minutes after dinner.
Even if it's, after any meal, even if it's just going up and down the stairs real quick, or even if it's not a 10-minute walk, you can do just a quick movement.
Get the blood moving a little bit.
Okay, that's cool. Because I could do that after every meal, just, go up and down the stairs several times. All right, weight training, walk after the meal, and the CGM, and track it, using the app to see what the trends are and what's causing those. Is that it for now? Is that anything
I think it's
else?
a good start.
Yeah, I mean, I don't want to get overwhelmed. I want to be able to have something I can stick with.
Well, this is where I think it's important to have a good partnership with your provider, right? Where you have a personalized plan where you can sit down and come up with an action plan and come up with kind of the next steps and what areas we want to focus on. And then as you do well and are doing well in those certain areas, as you've kind of addressed those pillars of health and you're in a good place there, we can move on to the next. And I think it's just important that you have a good relationship with a provider that you trust, and that you have, again, can make some of these goals and have some shared decision making together to really accomplish and to live longer and live stronger, like
there
you
it
said.
is. There it
Love
is. And by the way, and I'm not, this isn't a plug, this is just me speaking straight from the heart. You are that provider, that trusted provider for me. You're the person I look to guide me on this longevity journey, on my wellness journey, because I know your motives are pure. What you want from me is what I want from me. You have the medical background and the clinical understanding that goes beyond kind of traditional Western medicine and expands really into all the areas of functional medicine and nutrition, and you marry all these disciplines together to provide a personalized plan for me, for your other patients, and I just, I got to tell you, I feel so fortunate, so blessed to have you on my team and be that trusted person to me. And Dr. Benjamin Fogg is one of the principals of Wasatch Optimal Wellness, or WOW, right here in Heber, Utah, the most beautiful valley in all the world.
Agree.
And so he is literally transforming lives just every day by using this approach, this personalized medicine approach that is so needed in today's world of medicine, where the paradigm of treating the symptoms and the illnesses by writing a prescription just doesn't cut it. That does not help people live longer.
Right.
That does not increase longevity. It's getting to the root. It's understanding the systemic stuff, the underlying issues,
Yep.
and then addressing those in a real systematic way. And so I'm just such a big believer in this, and I've already seen the little I've done already has made such a difference in how I feel, how I look. I mean, have I ever looked better?
So we are really grateful that Dr. Fogg was able to join us.
Yeah, you're awesome, Ben. We just think the world of you and appreciate your help and your mentorship and guidance on my journey. And you're a real superstar in this field. I like I said, I just feel so blessed to have your expertise and have you cheering me on and teaching me and leading me on this cool trip. So anyway, it's just
I appreciate it. I love what I do. I love my patients. I love the relationships that we have. And it is my goal to help people live longer and live stronger.
Love it.
And so I'm honored to be part of this. And again, thank you for having me part of it.
It's our pleasure, and just we're honored to have you on this journey with us and have your expertise. And I know that our listeners will be inspired and they will seek out a Ben Fogg in their community. But thanks again, and this has been a really fun episode and way less scary than I was pretty freaked out about this. Like, oh my goodness, this could be so much bad news.
Yeah.
No,
and I'm coming away
passed.
encouraged. I'm coming away feeling like, okay, I'm doing okay. There's some areas to work on, and we have an action plan to kind of start with a few simple things that have big impact, and then from there we'll tackle the next issue. So can't thank you enough. And this is such a delight. And this has been Live Longer, Live Stronger. And until next time, I'm Brad Lauder.
Karis Lauder, and our wonderful guest, Dr. Ben Fogg. Ben, thanks so much for being here.
See ya.
thank you for
We'll see
having
y'all.
me.